Okay, so in the next lecture, I want to talk about what I think is a really good, a really compelling argument for physician assisted suicide. In this one, I want to talk about an argument that some people will present. The philosopher's brief I had you guys read doesn't really put a lot of weight on this argument, but it does bring it up in passing. And some philosophers, most notably James Rachels, have made this argument. And that's just an argument that if we're consistent, if we recognize a right to refuse treatment, which we do, we should also recognize a right to physician assisted suicide. Now, I'm going to go through this pretty quickly because I ultimately don't think it's a great argument, but it is, the philosopher's brief does touch on it. You will see other people developing it at more length, so I think it's worth talking about a little bit. There's a whole piece by this guy James Rachels, as I said, that covers this. I used to assign it. I don't anymore because I don't think this is ultimately a super compelling argument, but it's out there. A lot of people do mention it, so it's worth talking about. And it touches on some of the issues that we talked about when covering the abortion debate. Okay, so as we said in the last lecture, the right to refuse treatment means that medical professionals must let patients refuse even life-saving or life-extending treatments. If the patient chooses not to have this treatment, they have to let them die. Well, you might say, well, what's to keep us from taking this a step further? Why not say, well, if they have to let them die, medical professionals should also help them die? If we're going to say that there's a right to be let die, then wouldn't consistency say that there's also a right to have help in dying? Here's the sort of quick and dirty argument for this position, for this sort of argument for physician-assisted suicide. There is no difference between killing and letting die. So if medical professionals let competent patients die to respect their wishes, medical professionals should also kill competent patients who want to die to respect their wishes. Medical professionals do and should allow competent patients to die to respect their wishes, so medical professionals should kill or at least be allowed to help to die competent patients who want to die. Well, is this a good argument? Well, if not, which of the premises would you push back on? I think 2 and 3, 2 is just a sort of if-then, 3 is a statement of accepted medical practice. 2 and 3 seem pretty solid to me. If this argument goes wrong, and I think it does, then I think it has to go wrong with premise 1. There is no difference between killing a patient and letting them die. Well, look, usually we think there's a pretty big distinction between doing something and letting something happen. Think about organ donation, organ transplants. If someone is an alcoholic and he's wrecked his liver, and we have to choose, well, do we give him a liver or do we give this younger person who doesn't drink? Well, we're probably going to give it to the younger person to extend their life. We think it's going to do them more good than if we gave it to the older alcoholic, right? We would let the alcoholic die, even though we could save him by giving him the liver, because we think it would be better used to save the younger person who's not going to wreck it through alcoholism. It is, in this circumstance, justifiable to let this person die. We'll talk more about this distinction when we talk about Singer later in the semester, but it is a very important distinction. Now, on the other hand, we would not think it is okay to kill someone in similar circumstances. If someone was, say, an alcoholic, we're like, oh, he's wrecking his liver. Well, we could save somebody who's not an alcoholic, who's going to make better use of the liver by killing this alcoholic. Well, no one would think that that is a good reason to kill him and take his liver or other organs, right? It's justifiable to let someone in a similar case die by not giving them a liver they need to survive. It is not justifiable to actively kill someone for their organs, even if by doing so you could save a life, right? Lots of other cases where this doing versus letting happen distinction is very important. We need this distinction for a lot of our moral thought, a lot of our everyday judgments. Okay. And again, we will talk about this more when we get to Singer. He also tries to challenge this distinction. Not sure how successful he's going to be. Now look. The argument, the piece I didn't give you guys by Rachel's, he makes an argument for premise one here, that there's no difference between killing a patient and letting them die. In fact, he tries to make this very general argument, no difference between killing and letting die. Generally, I just don't think it's a good argument. There is, it seems to me, a very big difference between killing and letting die. Lots of cases where it would be okay to let someone die, where it would not be okay to kill someone in a similar circumstance, right? If you can only save 2 people drowning in the water and one of them is your son or your mother or whoever and one is a stranger, you can acceptably let the stranger die so that you could save your family member, right? You could not murder an innocent stranger to save a family member from drowning or whatever. Big difference between killing and letting die. And Rachel's, I don't give you guys the piece because I just don't think he has a weird, clever little hypothetical like Thompson's violinist case. I just don't think it establishes this really radical idea that we should just let go of the killing, letting die distinction. The doing versus letting happen distinction more generally. Now look, the Philosopher's Brief mentions this, it kind of hems and haws, waves its hands. It tries to say, well, maybe in some cases there's a difference between doing and letting happen, but when you start talking about not giving someone water and food through a feeding tube to let them die versus killing them versus not giving them treatment versus stopping treatment, they'll say, well, in real world cases, especially with medicine, these things get blurry. And their thought is, well, the distinction's blurry, so let's just scrap it, right? That also doesn't seem like a good argument to me, right? Lots of distinctions are blurry. We don't scrap them, right? The distinction between just thinking about robbing a bank very seriously and actually planning to rob a bank is a blurry one, right? We wouldn't want to get rid of it and say that, well, everyone who even seriously thinks about robbing a bank should go to jail, right? The distinction between, the cops entrapping somebody, pushing them into doing something he doesn't want to do that's illegal so they can arrest him, and just letting him do something illegal when he wants to, like, he wants to, let's say a case of hiring a murderer, a hitman to kill somebody, it's a thin line between them pushing you to hey, don't you want to kill this person? And them just, when you ask to kill somebody, putting you in touch with a fake person. You know, there are blurry lines between entrapment and not entrapment. We wouldn't, for all that, say we should get rid of this and say that any sort of undercover or sting operation is entrapment, right? This is Eris's point when you read him against the Philosopher's Brief. Yes, in the real world, the distinction between killing someone, killing a patient, and letting them die can get a bit blurry. Not a good reason to throw the whole distinction out the window. Okay, so this is one line of argument you'll see for physician-assisted suicide. It's one that the Philosopher's Brief kind of, sorry for a bad pun, briefly mentions. I don't think it is a very good one, though, for the reasons I've been saying, for the reasons Eris will give. But that doesn't mean that the Philosopher's Brief doesn't have better arguments for physician-assisted suicide, and that there aren't better arguments by proponents of physician-assisted suicide for their position. In the next lecture, let's look at these better arguments.